Morning, Helen, and for listeners that have decided to tune in to hear a conversation with Helen Sparks, then I am delighted to be having a conversation today with you, Helen Sparks, Associate Practice Educator in NHS Grampian. Helen, because this is the first conversation that I have attempted to record to share with colleagues, I thought it might be helpful for me to set out what it is that I'm trying to achieve. So I, in the role that I do, have a brilliant opportunity to have lots of conversations with the fantastic colleagues across health and care. And some of the insights and reflections that I hear during my conversations, I thought would be really useful to share in a broader context. So you're a bit of a guinea pig here, Helen, in the first one, and I'm sure we will learn as we go. But really just about being able to share insights from the diversity of people who work in our health and care system, and actually the broad range of colleagues and different types of roles that it takes to keep a health and care system such as Grampians running. So, Helen, thank you for volunteering. And if we could start off with you just sharing with colleagues a bit about a typical day as an associate practice educator.
Thank you for inviting me here today, Caroline. So, yes, I'm Helen Spark. I'm an associate practice educator in medicine and on-schedule care at the ARI, and well, I joined the team in the middle of the pandemic, so it was a very sort of new role, if you like, and I sort of developed the role into the new way of working through the pandemic. So a typical day for myself, well, there is no sort of typical day really. There's no 2 days the same when you're an associate practice educator. For example, yesterday in the morning, myself and my colleague were doing fundamentals of care all morning with some new recruits coming through the bank. And in the afternoon, I was in the wards. So that's just one particular day. So this morning, I'm here having a discussion with yourself, Caroline, and then, you know, in the afternoon, I could be perhaps doing some interviews for the bank, where we've been involved in so many different aspects recently, whether it's been involved with recruitment, whether it's fundamentals of care, trying to implement and give people a better knowledge prior to coming into the hospital and taking on the role as healthcare support workers. Also, been involved as your own associate team and doing the different things and helping out where we can. Of course, the military has, as you know, been redeployed in, and we're trying to support them as much as we can. And you know, they're very capable, but it's nice to be able to support them in the role that they are doing, and just really letting them know that we are available and you know, there to help if they need us. But then at the same time, you also have improvement plans in place with other wards, perhaps whether it's staffing, whether it's a general, perhaps maybe down an audit type of way, if we can try and improve different things in different wards. So there's lots of different diverse jobs that we're doing from day to day, and different projects. And there's 6 of us as associate practice educators covering the various areas: Woodend, Cornhill, sick kids and surgical and so on. So we do touch base a lot as an APE team, and I think it's important that we do that, because, well, albeit through Teams, but it's important that we do touch base with each other just to see how we're doing. Can I do anything to help you? You know, I know you've got a lot on in your area, perhaps, right? I've got a free afternoon. Can I do anything to help you? And so on. So we're very good at doing that, and it's important that it really is, has helped us as a team, definitely.
Helen, there's a few thoughts that I've had when you've been sharing some of that. So the first one is, obviously we're both working from home today, and that has been an absolute consequence of the pandemic. I apologise if you can hear dogs in the background here. I've got a spaniel on one side and a lab on the other. but you've also said there that being able to have that team connection and team support's been really important. So what have been kind of your experiences around working from home and how you've managed that? Because I know some people have enjoyed it, but some people have really struggled with it.
Yes. Well, fortunately, I've actually tried to get into the office most days if I can. I'm not really a fan of working from home. I think it's because I'm a people person and I like company. Yes, I can work at home if I need to and things like that. Like today, if I've got a kind of more admin kind of day, but so it's not affected me as much. You know, there has been a few times where, you know, you've had to for whatever particular reason, and it's been fine because I know it's a short-term measure. But for me, I do like the routine of getting up and going to the office and carrying on with your day. So that's me really. But I know people have struggled with it, definitely. Yes.
Yeah, it can be quite isolating. Helen, I know you are an absolute advocate of, clearly as an associate practice educator, and of our healthcare support worker community within our workforce. And I'm interested because we've spoken before about career pathways.
Yes.
So I'm interested in what your career pathway has been to take you to where you are just now. You said you joined in this role during the pandemic. So that's my first question. And then also, what more do you think we could be doing to support the career development of healthcare support workers?
So yes, prior to joining the team here as an associate practice educator, I worked in the anchor unit, firstly with outpatients and then moving in with the APE team. And you know, it was never on my radar to be an associate practice educator. It was just because it was advertised, and a couple of my colleagues said to me, "Helen, I think you would be really good at doing that." And I thought, oh, don't be ridiculous. What do I know about practice education? Honestly, but then when I thought about it and went into it a little bit more depth, I thought, well, maybe I could do this. You know, you kind of doubt yourself, but actually, I did actually think, right, okay, let's see what I can and can't do here. And from that, it stemmed to, you know, they wanted to do a PowerPoint. Well, I'd never in my life done a PowerPoint before, never knew what that was. So that's how far things have moved on and how far I have moved on personally over the last 2 years. From actually been doubting myself to trying to, I suppose, empower the other healthcare support workers that are in the same situation. It doesn't matter of what banding, what grading you are, because you are a valued member of staff. And I think we forget that, and I think we forget how valued that we really are as healthcare support workers, and that we can achieve a lot of great things. As far as coming in brand new into the NHS, it would be great to have an academy, to have proper induction days. You have those 2 or 3 days purely learning the ins and outs, getting the healthcare support workers ward ready so that A, they're not like a rabbit in the headlights if they don't have perhaps healthcare experience in the past, and B, so that it's more beneficial to the ward, so that these people can actually stay and we can retain these healthcare support workers, because that's ultimately what we want to try and do. If we're spending all this time and effort training people, we want to hold on to them as well. So I think we need to try and just tell people, yes, you are doing an amazing job, and yes, you can do great things. There's plenty of courses that healthcare support workers are able to access now, far more than there ever was.
Mm-hmm.
We also have the healthcare support worker Facebook page, which again has got a lot of great links on there for people to access. They can come and speak to any of the team, whether it's if they're interested in perhaps staying as a healthcare support worker, then that is great, but they can still do other things, perhaps take on other tasks. Again, it's about your 4 pillars of practice, taking a little bit of ownership and thinking out the box a bit, and maybe taking on different projects in the ward, if it was something that was required, obviously, with the senior charge nurse, etc. But there are lots of options for healthcare support workers out there, whether it's permanent staff, whether it's on the bank, whether it's maybe that later on they might want to join the Open University route and go into nursing. You know, we're all for trying and develop and encourage that best we can.
Helen, that's brilliant. And so I'm hoping that this will go out in the daily brief, and we could put some contact details in for any of our healthcare support worker colleagues that have an interest, even just a conversation, and you're suggesting that they should reach out to one of the, did you say 6 associate practice educators?
Yes, and we have the generic email address as well, so any of us will be able to pick that up. We can come and have a chat with you, and we have all the support tools necessary and advice that we can sort of help you if we can.
Brilliant. So I'll make sure we put those details in the daily brief. Helen, you spoke about being valued and the critical role that healthcare support workers play, and I absolutely have seen that come to the fore, not just around healthcare support workers, but during the pandemic, the dedication and loyalty and commitment of all colleagues across health and care in Grampian has just been astonishing, actually, and it continues. It's not letting up. And I think there were a number of questions around that in my Q&A last week. One of the really, really important things to me as a chief exec is that we have an organisation, a culture, a set of behaviours where people feel exactly as you've described, so feel valued and have ownership of the services that they are working in and providing for the public. One of the things that I've been working through as we start to set out our new strategy is how we make sure that how do we achieve that? Yeah. And that's some of the most important parts of these conversations that I have is what you'll have heard of the We Care programme yes. that was started during the pandemic, and I think the principles around that are good. And I'm really keen to understand from the view of an associate practice educator, from you as Helen, and representing those colleagues that you work with most closely, what if we were to achieve that, have an organisation where colleagues feel valued, they take great pride and own the services that they shape with the people that receive those services, what would that feel like for you? What would that look like for you? What are some of the experiences you've had maybe over the past 2 years that have really made you think, I am a valued member of the team in Grampian? And it might actually be helpful to also share some of the experiences that you've had when you've thought, I'm not sure we've got that right.
Yes, so over the last 18 months, it hasn't been easy at all, as we all know, and we've all felt it, and we've all been in that situation where it's not been particularly nice on occasions, and we all have our down days and our off days and things like that. But I think that ultimately in nursing care, our ultimate goal is the patients, and obviously patient care is first and foremost. And I think that's really what gives you the drive, because we care as professionals, we care about each other, we care about the patients. And yes, it is difficult to keep smiling from time to time. And as I said, you know, sometimes you do just think, oh my goodness, you know, I don't know how much more we can take. It is frustrating, and it's you're not alone. I think that's the way you have to think about that, is that this is not just you feeling like that. That is really the world, because it's not just been NHS Grampian that's been affected by this. It has been a worldwide pandemic. So yes, for me, the way I would like to see things is actually having, well, more staff, definitely, so that the staff that we do have, we can retain, and that I think they would feel more valued if we did have that. It would be less pressure. And also, whether it's registered staff or healthcare support workers, I do feel that it's a great need. And really it's about, okay, how are we going to do that? How are we going to actually get those people in and retain these people in? I feel that, you know, as healthcare support workers at the moment, we are spending a lot of time getting people in the bank, but perhaps our substantial staff are getting forgotten about. There seems to be a bit of a gap here that we need to try and rectify. And I have figures for you as to what we have put through fundamentals of care over the last sort of 18 months. And you know, it'll just give you an insight as to just how many have come through the bank, but actually how many of those are actually active is the question. I don't know. I have emailed to try and find that out, but I've not heard back yet. It was just the other day. But definitely for me, and actually if we had more staff on the floor, it would enable them to actually have time to do the things like their healthcare support worker induction workbook, like the statutory and mandatory that we ask of them all the time. And then we get told, well, actually, I don't get time to do that. And we get told that every day. So, and I appreciate that, you know, and as associates, we'll come into the ward and say to them, you know, we're trying to chase this up, but something's come up there, sorry. We try and chase you know, try and chase them up for the ward, for them, to keep them up to date with their TURAS, to keep it's not our rules, we don't set the rules, but it's what has to be done. So we as associates try and enforce that, try and help senior charge nurses so that things are kept on top of. But time after time we come up against this saying we don't have the time. We do not have the time. Is this something that perhaps we could change, or can they do this in their own time but perhaps get toil back or paid time? I don't know. It's maybe, you know, a discussion we could have at some time. I don't know.
Yeah, Helen, I think a really important point. So it's interesting, isn't it? Because the first thing that everybody goes to is we need more people. And the reality, certainly in the Northeast, is there isn't a pipeline of ready-made people to come into health and care, and that's one of the conversations that I have with my team and with colleagues in government around. So what does this have to look like? So without dismissing that, but recognising how difficult it is. You've mentioned several times it's not just about recruiting new people, it's actually about holding on to some of the fantastic people that we already have. And if you come into work every day and are asked to do particular things and not given the time to do it, that doesn't make you feel valued, I don't think. I think that's one of the key things. So yeah, the conversations that I would like to get into with each different part of our work community and our workforce, because it is so diverse, is what would that look like for, in your instance, associate practice educators and the colleagues that you support, predominantly healthcare support workers. So how do we make sure that the education and training, be that mandatory training, adds value, but also how do we support that continuous development? And the point about the bank is well made. So I if you've got the figures, keen that you pop them into the conversation around how many colleagues we have recruited onto the bank, and people join the bank to do ad hoc shifts, and actually, is that compromising the time and effort that we're able to put into supporting those that are also in part-time and full-time roles not on the bank? So I think that's a really valid challenge, and something that we do need to work through, not just with healthcare support workers. I'm sure all of our broader colleagues would say, I don't get enough time to do what I need to do. So how do we truly value and recognise the education and development of people that we need to have those skills to deliver the patient care that you spoke about?
Yeah, definitely.
And I think that's really come through in the pandemic, actually, around the importance of that. So therefore, the role of associate practice educators, Helen, is critical in how we deliver that. And huge thanks to you and your colleagues for the work that you've done and the innovations that I know you've done, because I see and hear about them as I'm out and about chatting to people. So Helen, that's been a great conversation. Thank you so much for taking the time. Is there anything you would like to say just before we say goodbye?
No, Caroline, just thank you for your time today as well, and it's been valued, and hopefully it may have answered some questions going forward from the bulletin. Thank you.
Thanks, Helen.